Welcome to the Airway Management Masterclass, presented by ND Nursing Coaching. This video is designed to help you prepare for exams like AIIMS NORCET, RRB, ESIC, and DHS. Let's begin with our first question. What is the primary maneuver to open the airway in an unconscious patient with no suspected cervical spine injury? The correct answer is B, head tilt chin lift. This maneuver lifts the tongue away from the posterior pharyngeal wall, resolving the most common cause of obstruction. Remember, this is contraindicated if a spinal cord injury is suspected. Question 2. How do you measure the correct size of an oropharyngeal airway, or OPA? The correct answer is C, from the corner of the mouth to the angle of the jaw. Sizing is crucial. A device that is too large can obstruct the airway, and one that is too small will not hold the tongue forward. Next question. An oropharyngeal airway, OPA, is contraindicated in which patient? The correct answer is C, a conscious patient with an intact gag reflex. Inserting an OPA in this patient will likely stimulate vomiting, which carries a high risk of aspiration into the lungs. Use a nasopharyngeal airway instead. Question 4. What is the maximum duration for a single suctioning attempt in an adult patient? The correct answer is B, 10 to 15 seconds. Suctioning for too long removes oxygen from the airway, leading to hypoxia and bradycardia. Always hyperoxygenate the patient before suctioning. Question 5. Which suction pressure range is appropriate for an adult patient? The correct range is B, 80 to 120 millimeters of mercury. Excessive pressure can cause mucosal tissue damage and bleeding. Standard adult wall suction is typically set between 100 and 120 millimeters of mercury. Next, when inserting a nasopharyngeal airway NPA, the bevel should face which direction? The correct answer is A, towards the nasal septum. This technique allows the bevel to slide smoothly against the septum, preventing trauma to the fragile turbinates on the lateral wall. Always use a water-soluble lubricant first. Question 7. What is the preferred position for a patient receiving conscious oral suctioning? The correct answer is B, semi-Fowler's or high Fowler's position. Sitting upright facilitates breathing, aids effective coughing, and prevents aspiration. For an unconscious patient, use the lateral or side-lying position. Question 8. During endotracheal intubation, what is the maximum time allowed for each intubation attempt? The correct answer is B, 30 seconds. Limiting attempts to 30 seconds prevents severe hypoxia. If an attempt is unsuccessful, stop and ventilate the patient with a bag valve mask and 100% oxygen for 3 to 5 minutes before trying again. Question 9. Which laryngoscope blade is straight and designed to lift the epiglottis directly? The correct answer is B, the Miller blade. The straight Miller blade lifts the epiglottis directly and is often preferred for infants and children. The curved McIntosh blade lifts the epiglottis indirectly and is most common for adults. Question 10. What is the most reliable method to confirm correct placement of an endotracheal tube, ETT? The most reliable method is D, capnography, or end-tidal CO2. The detection of carbon dioxide in the exhaled air confirms the tube is in the trachea, or lungs, rather than the esophagus. Question 11. What is the primary purpose of the cuff on an endotracheal or tracheostomy tube? The correct answer is B, to prevent aspiration and allow ventilation. The inflated cuff seals the trachea, preventing leakage of oral secretions into the lungs and ensuring positive pressure ventilation is effective. Question 12. The nurse is performing tracheostomy care. Which type of dressing is avoided around the stoma? The correct answer is B, cotton-filled gauze. Cotton fibers can fray, be inhaled into the stoma, and cause aspiration or infection. Always use sterile pre-cut drain sponges or lint-free gauze. Question 13. What is the correct procedure for suctioning a tracheostomy? The correct procedure is B, applying suction only upon withdrawal. Inserting the catheter without suction until resistance is met prevents damage to the tracheal mucosa and oxygen depletion. Question 14. What emergency equipment must be at the bedside of a patient with a new tracheostomy? The correct answer is A, the obturator and replacement tubes. The obturator is critical for guiding a new tube back in if the original is accidentally dislodged. Always keep a tube of the same size and one size smaller nearby. Question 15. Which maneuver is used to open the airway in a patient with a suspected cervical spine injury? The correct answer is B, the jaw thrust maneuver. This maneuver moves the tongue forward without extending the neck, thus maintaining spinal precautions. The head tilt chin lift is contraindicated. Question 16. What is the purpose of the sniffing position during intubation? The correct answer is B, to align the 3 airway axes. The sniffing position, which involves neck flexion and head extension, aligns the axes of the mouth, pharynx, and larynx, providing the best view of the vocal cords. Question 17. What is the Selleck maneuver or cricoid pressure used for? The correct answer is B, to prevent aspiration and visualize the vocal cords. Pressure on the cricoid cartilage compresses the esophagus, preventing gastric regurgitation during intubation. Note that guidelines advise cautious use. Question 18. Which complication is indicated by a whistling sound during suctioning of a tracheostomy tube? The correct answer is B, mucus plug obstruction. A whistling sound or high-pressure alarm often indicates the catheter is meeting resistance from a thick secretion plug. Action may involve hydration or lavage to thin secretions. Question 19. What is the typical size of an endotracheal tube, ETT, for an average adult male? The correct answer is C, 8.0 to 8.5 millimeters inner diameter. Standard sizes are 8.0 to 8.5 millimeters for adult males and 7.0 to 7.5 millimeters for adult females. Question 20. The nurse hears gurgling sounds from a patient with a tracheostomy. What is the priority action? The correct answer is B, suction the patient. Gurgling sounds indicate secretions in the upper airway. Suctioning removes the obstruction and improves airway patency. Suction should be done as needed, not on a fixed schedule. Question 21. Which device delivers the highest concentration of oxygen, up to 90 to 100%, to a spontaneously breathing patient? The correct answer is D, non-rebreather mask, or NRM. The NRM provides nearly 100% FiO2 at 10 to 15 liters per minute flow due to its reservoir bag and valves that prevent rebreathing carbon dioxide. Question 22. What is the purpose of the fenestrated tracheostomy tube? The correct answer is B, to allow the patient to speak. The fenestration, or hole, allows air to flow up over the vocal cords when the inner cannula is removed, enabling speech. This type of tube is often used during weaning,